One of the primary systems we treat in physical therapy is the pulmonary system. In this video, we're going to introduce you to postural drainage and some manual techniques we use to help remove secretions for those with congested lungs. Our lungs are divided into lobes and then further subdivided into segments. Each segment functions independently and is fed by its own bronchus. Each of these different bronchi are oriented in different directions. So by changing our body position, we can change the orientation of the bronchus as well. Let's look at one individual segment. In the case of some illnesses or some disease processes, excessive secretions or mucus can build up within our lungs. One of the tools we have to help remove those secretions is postural drainage. The idea is to place our patient in a particular position that allows the involved segment to be vertical. This allows gravity to assist our normal airway clearance mechanisms. There are different positions for each lung segment. Additional videos provide the exact positioning for each individual lung segment, but let's look at one specific position in our intro video.
How do you lay? You're on the pillow? What is it? Just underneath your shoulders?
So let's see how this position orients our bronchi for our upper lobes and anterior segments. The anterior segments are highlighted in yellow. The goal is to try and get the bronchus aligned as close to vertical as possible. The minimum recommended time in a postural drainage position is 5 to 10 minutes. During positioning, the patient is encouraged to take deep breaths and to cough to clear any loose secretions during position changes. A treatment session may involve draining multiple segments. As with any intervention in physical therapy, you must be aware of any contraindications for use of that particular treatment. Since many of the postural drainage positions put our patient in the Trendelenburg position, we're always concerned with conditions that affect our head or our blood pressure. Frequently, we'll combine postural drainage with other manual techniques. Cupping and shaking are two techniques that help loosen secretions and move them into the larger airways. This is achieved by percussing and shaking in an area specific to the segment and the bronchus involved. Once a patient is placed in the postural drainage position, a cupping motion happens on the torso. The percussion on the torso helps break secretions loose from the alveoli and the smaller airways. To provide effective treatment, you must use proper technique. The hand position is a key component of performing cupping. To create the proper position, you want to make sure the fingers and thumb are held tightly together. The fingers should be bent slightly and the palm should be formed into a hollow shape. Just imagine you'll be using your hand as a cup. If you've done this right, you'll see that your hand is curved from proximal to distal and from radial to ulnar. What you want to make sure you don't do is cup with a flat hand. This hand position is less effective and more uncomfortable for the patient. There's a specific location cupping should be performed depending on which lung segment you're working on. The cupping should be rhythmic and at a pace of about 60 to 100 beats per minute. If your hand is in the right position, you should hear a popping noise.
Deep breath in.
2 to 3 minutes of cupping is followed by a shaking or vibration technique. The hands are laid flat on the torso while the patient fully inhales. As the patient exhales, a vibration motion is performed. This helps move the loosened secretions into the larger airways.
And exhale. And exhale.
If the patient then has secretions to expel, they can sit up and perform a forced expiratory maneuver such as a cough or huff. So a treatment cycle would consist of 2 to 3 minutes of cupping followed by 2 or 3 repetitions of vibration or shaking. If the patient has secretions to expel, they can perform a cough or huff. The cycle of cupping, shaking, and coughing can be repeated as long as it's productive. If the patient no longer has anything to expel, treatment can be stopped for that particular segment. In addition to the contraindications for postural drainage, there are separate contraindications for manual treatment. Because of the percussion motion, we need to be especially careful around the spine and the rib cage. Postural drainage can be a very effective technique to assist with the removal of secretions for patients that have an illness or chronic disease process such as cystic fibrosis or COPD. This technique can be performed either in the healthcare facility or at a patient's home. For a more effective treatment, manual techniques can be combined with the postural drainage positions. Cupping and shaking can help loosen secretions and make it easier for the patient to expel them. And always check for precautions and contraindications before performing any treatment.